Well, welcome back to Carolina in the Morning. Today we usually set aside some time with a visitor from the medical community, Frederick Meine. Dr. Meine, no exception to that rule. Coming in today, he's a cardiologist with K-Fair Heart Associates, here to talk about some myths that we have with cardiac disease. Good morning, doctor.
Morning.
Good to see you.
Thank you.
What are some of the myths that are with us? I know there are a lot of stereotypes we hear with heart disease, but in the preparation for the interview, one of the myths I saw that you had in there was age relation right off the bat.
Absolutely, Bob. One of the things that is really interesting and somewhat scary is how many young people are really coming down with heart disease. Just for example, from our acute heart attacks, patients that come into New Hanover with emergency heart attacks, more than a third of those people are in their 50s or younger, and more than 10% are in their 40s or younger. So really younger and younger people coming in with life-threatening heart problems.
I've noticed just not so much, major headlines, but just in everyday reading. I'll be 46 in November. More and more people my age I'm seeing died of heart attack 44, died of heart attack 48. I mean, I don't want to say that this is a trend, but it seems like it's very concerning now.
Absolutely, it's very concerning, and we see that here in Wilmington just like we see it in the entire country. And what we always tell our patients is that just because you're only 30 or 40 or 20, it's not too early to make sure you're not smoking, not too early to make sure you're eating right, not too early to exercise every day, and live as if you certainly are at risk for heart disease, because we all are.
As a physician who specializes in the heart, what are you mentioned health, you mentioned diet, but what are some of the things that people need to really pay attention for if they think there's a trouble there?
Well, if you think there's trouble, or if there's trouble in your family, for example, heart problems run in your family, we really encourage people to be especially aware of their risk factors, and those would be their blood pressure, knowing what your blood pressure is, knowing what your cholesterol is and treating that, not smoking, and exercising every day.
As far as medications go, cholesterol meds for statins and things like that, are those now, you hear a lot of people talk about diet and they can control that with diet. Are you seeing that where people, when they get into the habit of eating well, that they're actually able to come off their meds for things like that?
At times they are. Obviously that's something you'd want to talk to your specific doctor about, and to know your specific risk factors and what your cholesterol and your blood pressure is. But obviously there's no substitute for great diet, exercise, and great lifestyle.
What, in your opinion, is the biggest misnomer about cardiac disease?
That it can't happen to me, that it can happen to anybody, and that you've really got to know what your risk factors are, and you've got to treat them aggressively.
Okay, and I always finish our segment by saying, if you have questions, don't email me, don't call me. He went to school much longer than I did. That's why you've got the white one, I've got the gray one. Dr. Meine, I appreciate your time.
Thanks for having us.
Thank
Thanks,
you.
Bob.
All right, Colin, that's what you kind of